Hello, guys. Hi. It's fantastic news to tell you that we have here with us Dr. Chandrappriyan, who this time in November 2025 session of INES's Medical Gastroenterology, he has secured wonderful rank of AML 3. So I would want to discuss with Dr. Chandrappriyan and see how best we can gather information on how to study for these entrance exams and crack the code of entrance exam. Hi, Dr. Chandrapriyan. How are you?
Hi sir, I am fine sir. How are you sir?
I'm fine. How are you feeling? How are things now?
Absolutely great sir.
Great, great. So you got CML of 2 and AML of 3, right?
Yes sir.
Yeah. So super single digit numbers. How did you even manage getting this? Yeah, it's so difficult. So many people around.
Uh, yes sir,
Really.
this time around the competition was really tough sir. I wouldn't lie. And personally, on a personal level, I felt the theory paper was a bit tougher on the tougher side. But
Mhm.
after giving the theory, when you did a review session, you told that it was an easier paper, so I was shocked. So I was thinking that maybe it was only tough for me. So I wasn't expecting this rank anyway. But then things turned out great anyway.
Great, great. Sometimes when we may not be able to predict comparatively how students would feel, also some may be very easy. We are doing it day and night. That may be difficult at the stage of you would realize like after practice, some may become very easy. Some are like super difficult questions, which could have been very easy for a student preparing for exam. So, Dr. Chandrapriyan, where are you from? Where did you do your UG, PG? Why gastro of all the branches?
Sir, I am basically from Tamil Nadu, Madurai, sir. I did my UG from Madurai Vellamon Medical College, and I did my PG MD General Medicine from AIMS Raipur, sir. Then, after finishing my MD, I worked as an SR in AIMS Raipur Gastroenterology Department, and I attempted this exam this time, and I secured this time.
Okay, great. So, vanakkam. So happy to know that you're from Tamil Nadu.
Welcome, sir.
To know, good to know.
Welcome,
So,
sir.
how come? Do you feel you mentioned that in after your DM you were in medical gastroenterology for a small time, right? So,
Yes,
did
sir.
it really help you, or for the interview round? Where do you feel that working in a medical gastro department after MD helps?
Absolutely, sir. It really works. The way we approach, because there is not much of core gastroenterology, no, not much of core gastroenterology exposure during the MD training. So working in the department here really helped me a lot, sir. And the way to approach cases and the way we think and how to work up those cases, all those things helped me to in this preparation. So, and I had a very great mentor, Dr. Tanmay sir here, and yeah, and things are just really clear. It really helped me a lot, sir.
Superb, superb. So, working helps. If you have time to work, please work in medical gastro department before taking medical gastro. You would probably it's like engagement before a marriage, direct and direct marriage. So you would probably have a better time. You can at least gauge the situation before prior. So good.
Yes, sir.
So let's break it down into two important bits. First is theory. How did you crack the code of MCQs in medical gastro plus medicine in an all India exam?
Yes, sir. For gastroenterology, I felt that MCQ practice and giving GPs did the trick, sir. Although we read the subject matter anyway, and the way the questions are structured, it is different. And the questions, how do you approach a case, and the next step, what is the next step, what is the best step, all these kind of practical oriented questions are coming, which obviously while working also I picked up few things which helped me crack those questions. But regarding medicines are there is a set pattern which they focus in INISS exams. There is a set of favorite topics for them which they repeatedly test. I think covering that to a good extent will help us cover medicine. Sir. That much only. I didn't read medicine top to bottom again. I just covered the topics which are repeatedly tested and which are must know topics from medicine. So that only I covered. And regarding practicals, sir, I watched I watched your live sessions and spotters are absolutely exhaustive, sir. Your spotters are absolutely exhaustive, and the case scenario questions, especially the cohort that you show us, almost that is the case scenario based questions we asked in this faculty.
Super, super. Okay, very great. Happy to know that for theory, basically it's about repeated reading, high yield points from the textbooks, and also giving yourself the exams to assess yourself really helps. Followed by once you get selected for the interview, how calm you are and our approach, what you would have heard, and the mock sessions really helped
Yes,
you,
sir.
isn't it?
Yes,
Okay.
yes,
So, if somebody has just completed their MD now and they are
yes,
wishing to become a gastroenterologist,
yes.
what do you suggest? Among so many options available, there is NEET SS, there is INE SS. What should be the
Hmm.
mentality, and how should I go about if I've just passed my MD medicine today?
Sir, after just passing MD medicine, the core target should be NEET SS because at that time there is not much of maturity to know that this is what I want to do lifelong. Because once super specialty is chosen, that you have to do lifelong. That is one very big decision. So INISS, if you are absolutely sure to take that branch only, then very well go ahead and prepare for INISS, concentrating on that subject only. But you are still searching about what subject you are not fixed on a particular subject, then NEET SS is the way to go.
Okay. So, if you're selective, INE SS. If you're non-selective, go for NEET SS and then decide.
Yes, sir.
Great. So once I select I want medical gastro, what do you think
Yes,
should be the ideal strategy to start off? Suppose I have 4 months to 6 months, 4 months time for my
yes, sir.
theory paper in ESS. How should I
Yes,
divide
sir.
the entire medical gastro?
Sir, medical gastro, solving the Q bank and watching the videos. It might not be possible for everybody because everybody to read the entire slicing in that time frame, which is not possible. So videos which give us a good chunk of the information in a very bite-sized manner, and that videos to be completed and from that videos how we apply the knowledge in solving MCQs. For that, MCQ practice and GT practice is the most important, sir. And once the part of preparation is done, giving regular GTs helps a lot because GTs will tell you what are the areas we are weak. So I used to have a mistakes log in which I used to write after every GT I would dissect the GT and I would make a note of all the mistakes that I have done in that GT. And I used to categorize those mistakes, whether these are silly mistakes, whether these are knowledge gap mistakes, or whether this is due to lack of revision. So I used to categorize the mistakes. And the first level of target is to remove silly mistakes first. Then knowledge gap you need to fix. Then the lack of revision knowledge mistakes, those mistakes that we need to first tackle it. And at the end, before 1 or 2 days before the exam, I just revised my mistakes log because that log told me, gave me an insight into my own preparation. So these are the areas which I must absolutely not make a mistake again. So this is how I approach the theory, sir. And regarding interview session, watching your live sessions and those spotters, that much is enough, sir. For a fresher MD pass out. That much is enough.
Superb. You have given a blueprint for all our MD, DNB medicine guys to follow for any branch of their choice and to be more specific for medical gastroenterology. Great, Dr. Chandrappriyan. Wish you all the best. Welcome to the Club of Gastroenterologists soon, and we'll
Thank
definitely
you, sir.
catch up some or the other conferences. We'll all catch up. Please
Sure, sir.
continue the growth phase, and we'll all learn the amazing branch of medical gastroenterology together.
Sure, sir. Thank you.
Thank
Thank
you.
you.
Thank you for being on the show. Thanks.
Okay.